Teachers have died from the coronavirus since the start of the school year. President Trump still urging schools to reopen on Twitter just this morning. There is that tweet. Meanwhile, coronavirus cases at colleges have been reported in every state, including at the University of Tennessee, where more than 2,100 students and staff are currently under quarantine. So have schools reopened properly and safely? Here to answer that question, as well as talk the latest on the vaccine front, is Dr. Owais Durrani, who is specializing in emergency medicine at UT Health San Antonio. Doctor, welcome to the show. We are now learning, like I mentioned, at least 6 teachers have died from COVID-19 since schools reopened. When you heard this number, what did you think?
First of all, condolences to those families. It's truly an unfortunate situation. I can't say that I was surprised, unfortunately. Kind of the broad consensus is that we need to be opening schools and various types of businesses once we hit that 6% and lower positivity rate. In a lot of the country, honestly, most of the country, we're not at that number. And so when some school districts made that decision to open when we were not there, when we didn't have quick enough turnaround times on testing, it was something that was unfortunately to be expected. The other unfortunate part is I've heard of a lot of stories from teachers and some college professors where they were not given the option to teach remotely. It was either they had to choose between their jobs or their health, and that's unfortunate. I'm a huge fan of the NBA, and a lot of the pro sports allowed athletes to opt out of their seasons. And so I think teachers should have the ability to teach remotely if they feel that that's the best for their health.
That's actually a really good point that you made. What more should schools be doing to prepare for in-class learning, especially now that so many schools have opened up and are allowing students inside?
Yeah, so for example, in a lot of the Texas schools, they're still remote. A lot of those school districts are about to make the decision whether they are about to switch from remote to in-person learning. I think, first of all, if we're not at that 6% number, please make that decision to continue remote learning. The other part is, we've talked about it a billion times, social distancing and testing. That is still the core thing that's going to get us through this. So getting funding for faster turnaround in testing and getting testing to all school districts, all students, and making sure that we are social distancing when we're in class. And that means we need to evolve on our social distancing strategy. So not just setting in place guidelines and then not changing those, finding what works, what doesn't work, and continuing to make it better and safer for our teachers and students.
It does seem that many of these cases are coming from schools, primarily college students. I was surprised to learn this. Colleges in all 50 states are reporting infections, also accounting for 40,000 cases across the country. Doctor, what does that tell us?
That tells us essentially, once again, what we expected. A lot of colleges, even though community spread and where that college is might not be as high, students travel from across the state and across the country. And so having that type of travel is going to lead to those numbers. And then, of course, we've all seen the images of large parties and whatnot. And so having that is going to lead to those super spreader events and high positivity rates. Texas is a huge, football state, and we have a lot of our large colleges going back to football. And even though they're going back to football with a 25% capacity at most stadiums, these stadiums hold 110,000 people. And so I don't think putting 25,000 students and other fans in a stadium is going to lead to good results. The final kind of component of that worries me is a lot of students, like to travel home naturally. And so what's going to happen when these students go back to their communities and potentially take that disease with them?
Dr. Durrani, I want to talk a little bit more globally now, pivot just a little bit, because this morning we got the total number of deaths attributed to the coronavirus around the world is 900,000, approaching the grim death toll of almost 200,000. However, we should mention the rate of the infection has slowed down around the world. Has the disease become a little less deadly?
We don't have evidence of that yet. What we do know is we know a lot more about the disease compared to 6 months ago. And so we know how to mitigate some of the worst effects of this disease. And so things like proning patients, therapeutics like steroids, medications like remdesivir, that's mitigating some of these effects and extending and prolonging the life of patients with COVID. And so that has a big part to do with it. The other thing is, during from March to May, a lot of our nursing home communities were being stricken hard with COVID. And so we've really targeted testing towards those communities, isolated them, and ensured that they are not continuing to get the worst effects of this pandemic. And then finally, testing. We are testing a lot more compared to March and April. We're still not to where we need to be, but we are testing a lot more. And so catching asymptomatic patients and milder cases of the disease is going to make that fatality number lower.
We have to talk about vaccines. We're learning more details about AstraZeneca, including the trials that have been halted after a patient got sick in the UK. Is the starting and stopping normal for a medical trial? And are experts concerned, or is this part of the whole process when a medical trial is underway?
Yeah, so completely to be expected. This is exactly why we do clinical trials. Normally, these trials take years, and they're not under the amount of public scrutiny and public attention that these trials are now. When you enroll thousands of patients in a trial, some of them are going to get sick. And so the whole point of that trial is to figure out, did they get sick because of the vaccine, or was it because of other causes? And this is the type of process that leads us to gaining trust in that final vaccine that eventually will be released. It has to be a science-based, methodical approach that has no politics involved in it. And so this is something that I'm not surprised by. We have to find out more about this patient, what disease they developed from it. Was it because of the vaccine or other causes? The other thing I'll say is, even though we don't have a COVID vaccine, we do have the flu vaccine. I got mine 2 days ago, and it's very, very important for everyone to get that. The last thing we need is a flu pandemic that's running rampant amidst the COVID-19 pandemic.
Thank you so much for your medical perspective. Dr. Owais Durrani at UT Health San Antonio. We really appreciate your insight. Thank you so much.